timing may not be right for the product that you have. So when I opened up a practice with memberships where in an area that it was almost unheard of, it's very difficult. So the timing may not have been right. It's possible that, you take 5 years, 10 years from now, that if I were to open up the exact same practice, that it is possible that I would have had a larger patient panel.
What was your final patient panel size before you transitioned into this new opportunity?
I think I was almost reaching 200. So it's actually pretty good. It was actually pretty good. Many concierge practices that charge rates literally 10 times what I charge, they may have patient panels that are less than that even. So like I said, in my heart, I love serving people and wasn't out to serve the rich. So I did want to have a larger patient panel than I did end up with.
Okay. So let's talk a little bit now about the new and exciting opportunity that you're involved in, OSF. Kind of walk us through what you're doing and what is OSF Complete Care.
So OSF is a Catholic faith-based hospital system. They're based in Peoria, Illinois. They have 16 hospitals amongst Illinois, Michigan, and Wisconsin. And they are a really wonderful hospital system to work for so far. I honestly did not know much about OSF prior to me starting with them, but I'm glad I am part of them. OSF has a really wonderful work culture. They really care about the employees are actually named mission partners. So we don't use the word employee at OSF. We use the word mission partner, and it really is an appropriate term because it just reiterates how we as mission partners, every day we are out to serve the mission of OSF, which is to serve with the greatest care and love. And that is actually part of what we say every day at Complete Care 55 Plus, this new model. It's a twist on primary care. It actually has a target audience of those 55 years and beyond with at least 1 to 2 medical chronic conditions. And we are out to help patients have a better life from the perspective meeting these patients where they're at, because life is busy, having their healthcare be accessible to them, and providing what our patients need in terms of regular office visits, whether they're virtual or in person, so that they can address their medical needs, their chronic conditions, being able to see them regularly, and their acute conditions in a very timely manner.
So is this model, you said it's kind of a twist on primary care. Would you say that Complete Care 55 Plus is similar to direct primary care? Is it like a concierge practice? And if so, how is it similar?
It is similar from the perspective of the care and attention and the personalized service that I provided in my prior concierge-style practice. The appointment times are a little bit longer than traditional primary care, where many times you're rushed as a provider, double booked. We don't do that at Complete Care 55 Plus. We take the time to get to know our patients. Even before, as a provider, a patient comes to the office, we do an extensive intake to not just get a list of the medical condition someone has, but really get more information on those social determinants of health, try to identify where a person is in their healthcare journey and maybe factors outside of their health conditions that they may be coming in for, factors that may be affecting their health.